Module 46 Filariae. Module 46 Filariae. Learning objective. After reading this module, the learner will understand the following: vector-borne, nematode, ruminant, and other animal. Microfilaria, the infective stage present in the circulatory system. Filariae dermatitis caused economic loss. Dirofilaria immitis. Morphology. Family Filariae. Genus Dirofilaria. Species Dirofilaria immitis. Location right ventricle and pulmonary artery. Intermediate host mosquito, Culex, Aedes and Anopheles. Common name heartworm of dog. Morphology. Worms are long, thin and white in color. Mouth is very small and lips are absent. Male is smaller than the female. Posterior end of male is spirally colloid. The spicules are unequal and the left spicule is blunt. In female, vulva is situated at the anterior extremity. They are larviparous or viviparous. Larvae of filariid is known as microfilaria, which are found in the blood of the host. Dirofilaria immitis life cycle. Adult mosquitoes ingest the microfilaria along with blood meal while feeding on the direct host. Ingestion microfilaria are first found in the stomach of mosquito, then migrate to the Malpighian tubule, where the further development occurs. In about 4 days, it will develop into a sausage from example second stage larvae. The sausage from become elongated sausage from in 9 days. It feeds on the cell of Malpighian tubule and enter into the hemocoel cavity. From there, they migrate through the thorax and reach the mouth part where it becomes the infective stage. The dog get infected when the infected mosquito feed on them by inoculation. Dirofilaria immitis pathogenesis. Mild infection cause no clinical sign, whereas heavy infection cause circulatory distress due to mechanical interference. Presence of large number of worms in the heart will interfere with the function of the cardiac valve. Heartworm primarily causes pulmonary circulatory disturbance, lead to pulmonary hypertension due to narrowing of pulmonary peripheral artery. Common compensatory hypertrophy of right ventricle result in congestive heart failure, liver failure syndrome, and peripheral edema. Dirofilaria immitis clinical sign: deep, soft cough, reduced stamina, hemoptysis, dark brown color, feces containing hemoglobin and bilirubin. Anorexia and anemia may also be seen. Dirofilaria immitis diagnosis: blood smear examination, stain, weight film examination. Note method: 1 ml of blood plus 9 ml of 2% formalin, centrifuge for 5 minutes. Then the sediment is to be stained with methylene blue. X-ray, serological test, ELISA, IFAT. Treatment against microfilaria: DEC 5.5 mg per kg body weight for 2 months. Mebendazole 80 mg per kg body weight for 30 days. Levamisole 10 mg per kg body weight 50 to 20 days. Ivermectin 200 mg per kg body weight subcutaneous against adults. Control against microfilaria. Control of mosquitoes. Morphology of Stephanofilaria assaminensis. Species Stephanofilaria assaminensis. Internal host mucosa conductance. It causes hump sore in cattle. It is a chronic dermatitis. Vermicious dermatitis and cascado. In Asian and West Bengal, about 90% of cattle are affected and 59% in Andaman. Morphology: mouth is surrounded by cuticular rim which is denticulated. Spicule is unequal. Stephanofilaria pathogenesis. Poor condition and high rainfall are the predisposing factor for the condition. Following infection, the lesion initially appear as large number of small papules. Later on, they join together and form a large lesion which is covered with thick crust. Where will be inflammatory changes and pruritus. This lead to constant rubbing of the body against hard objects, and the condition is aggravated by self-mutilation. Hyperkeratosis, acanthosis, and alopecia may also occur. The lesions are rich in blood and lymph and readily squeezed. The lesions extend outward with the central thick dry crust. The lesion may reach up to 25 mm in dia and resolve during the dry cool season but reappear during rainy season. Stephanofilaria diagnosis: examination of deep skin scraping. The scraping should be made only after the crust is formed. Microfilaria will found. Stephanofilaria treatment: trichlorophon ointment 6 to 8% in petroleum jelly or castor oil. Morphology of Parafilaria bovicola species. Bovicola host cattle and buffalo. Location intramuscular and subcutaneous. Internal host Musca species Musca lusoria. It causes hemorrhagic nodule on the skin of cattle and buffalo. The condition is known as summer bleeding. Morphology: the anterior end of worm bears 13 rows of cuticular elevation of thickening. Remaining portion of body is transversely striated. In female, vulva is situated at anterior end. Musca get infected when feed on lacrimal secretion or existing wound. The larvae enter into the host via lacrimal duct or wound. Parafilaria pathogenesis: subcutaneous nodules are seen mainly on the shoulder region and on the dorsal aspect of loins with the neck, the body. The nodules are 12 to 15 mm in dia and 5 to 7 mm in height. The gravid female move to dermis of oviposition egg-laying. During this period, the nodule becomes enlarged and painful hemorrhages may occur. There will be marked edema and infiltration of lymphocytes and neutrophils. Parafilaria treatment: nitroxyl 20 mg per kg body weight subcutaneous. Febendazole and albendazole can be used. Dirofilaria repens. Dirofilaria repens. Host dog and cat. Location adult, found in subcutaneous tissue and the microfilaria in the blood and lymph. Pathogenesis: being transmitted through mosquito. These worms are frequently found in the anterior chamber of eye in human being as accidental parasite causing difficulties in vision. Dipetolonema reconditum. Dipetolonema reconditum is a parasite rarely caused significant disease. Its importance lies in the fact that its microfilaria can be easily confused with those of Dirofilaria immitis. Parafilaria reconditum live in the body cavity and subcutaneous, just below the skin tissue of dog. Life cycle: the life cycle of D. reconditum include an intermediate host such as flea, tick, or louse instead of the mosquito. Morphology: the adult worms, which are half to 1 inch long, may be found on necropsy or as an accidental finding during surgery for some other reason. The microfilaria can be found in the bloodstream Based on their size and shape, your veterinary should be able to distinguish them from heartworm microfilaria under the microscope. The presence of a decondytum infection should not affect the common serologic tests used to diagnose heartworm. Pathogenesis and control. Usually, no treatment of a decondytum infestation is required. However, a single treatment of ivermectin 0.11 mg RB will eliminate the microfilaria. It is known if any antihelminthic will kill the adult worm. Since it is not considered a pathogen, few efforts have been made towards its prevention or control. Controlling the filia ticks and lice population would be beneficial. Module 47 Sitteridae. Module 47 Sitteridae. Learning objective. After reading this module, the learner will understand the following: mosquito-borne filariid nematodes commonly seen in cattle and buffalo, internal eyeworm of cattle, lumbar paralysis in accidental host like sheep, morphology of Setaria digitata, genus Setaria, species digitata, host cattle and buffalo, location peritoneal cavity and urinary bladder, internal host mosquitoes, gulus, aedes and anopheles. Morphology. Worms are long and milky white in color. Mouth is surrounded by a chitinous ring called as peribuccal ring. It has lateral, ventral and dorsal prominence. Body of the worm tapers toward the tail and the posterior end is spirally coiled. Tail end of both sexes has small lateral appendages. Female tail end has a small knob-like conical projection and may be armed with a small spine. Setaria digitata pathogenesis. Adult parasites are not pathogenic, but in some cases they cause peritonitis and lesion in the urinary bladder. Accidental Setaria infection can occur in cattle in the anterior chamber of the eye of horses with immature or adult Setaria digitata or as Labiota papilosa. Anterior chamber of eye in a horse clinically affected with Setaria infection. Setaria digitata and zoonotic cerebrospinal nematodiasis or Kumri or lumbar paralysis. It is a condition caused by erratic migration of immature stage of S. digitata in the unnatural host like horse, sheep, and goat. The condition is more prevalent in summer since the mosquito activity is more. The affected animals suffer from acute fecal encephalomalacia. The migrating worm produce trach and degeneration of tissue in CNS. Setaria digitata clinical sign. It dependent upon the site of lesion, muscular weakness, ataxia, paralysis of hind limb, and sometimes blindness may also occur. Microfilaria of Setaria in bovinus also cause a syndrome consisting of systemic disease in affected animal with variety of symptoms. Setaria digitata treatment DAC 40 mg per kg body weight. Onchocerca gibsoni, host cattle, location brisket and the external surface of hind limb. Morphology: male 30 to 53 mm long and the female 140 to 190 mm long. Tail of the male is curved when tread. It bears small laterally and 6 to 9 papillae on either side. The spicule 0.14 to 0.22 mm and 0.047 0.994 mm respectively. Intermediate hole culicoids pungens. Life cycle. The life cycle of the Onchocerca species is typically filarioid, with exception that the microfilary occurs in the tissue space of the skin rather than in the peripheral bloodstream. Diagnosis depends on the finding of microfilary in skin biopsy samples. Treatment: diethyl carbamazine. Control: use of microfilarides reduce the number of infected fly. Onchocerca volvulus, Onchocerca volvulus, host, human being rarely in animal. Intermediate host black fly, Simulium. Morphology: adult of Onchocerca volvulus are long and slender, have a smooth cuticle and have blunt anterior and posterior end. There are no lip or buccal capsule, and the mouth is surrounded by two circles made up for papillae. The esophagus does not appear to be divided. Male range in length from 90 to 42 cm and range in width from 130 to 120 micrometers. Lacking elli, their tail are curled ventrally and bear 6 or 8 pair of posternal and 4 pair of adrenal papillae. Female are longer than male, ranging in length from 33.5 to 50 cm and wide width from 270 to 400 micrometers. Their vulva is directly behind the posterior end of the esophagus. The microfilaria released by adult female are 250 to 300 micrometer long, are unsaturated and have sharply pointed and curved tail. Life cycle. Volvulus begin when a parasitized female black fly of the genus Simulium take a blood meal. The microfilaria form of the parasite found in the dermis of the host is ingested by the black fly. The microfilaria then penetrate the gut and migrate to thoracic flight muscles of the black fly, entering its first larval phase. After maturing into J2 and second larval phase is migrate to the proboscis, where it can be found in the saliva containing stage 3. Volvulus larva passes into the blood of the host. Treatment: ivermectin, control of black fly formation. Affected people treatment of by ivermectin. Onchocerca armillata. Onchocerca armillata. Cattle are the most susceptible species. The diagnosis of the infection by skin sniff examination, and some also at post-mortem examination. Infection is more common between 9 months and 8 years. Prevalence rate and number of microfilaria per gram of skin were higher in male than in female cattle. Several pathological changes were seen in the thoracic aorta, brachiocephalic, costo-cervical and brachial arteries, and posteriorly in the abdominal aorta to its bifurcation into the iliac artery.